everyone, this is Mary Rose Garcia, a second-year nursing student from Section WIEDENBACH. So for today's video, I'm going to perform nasal instillation. Nasal instillations are used to treat allergies, sinus infections, and nasal congestion. The nose is not normally a thorough cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully when using nasal instillations. Assess the nares for redness, erythema, edema, drainage, or tenderness. Second is to assess the patient for allergies. Verify the patient's name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Lastly is to assess the patient's ability to cooperate with the procedure. One is to instill the medication directly on the nares or nostril. To provide means for nasal evaluation. To obtain desired therapeutic effect. For the equipments, we need to have medication dropper, if not part of medication container, gloves, tissue, and medication card.
Step 1. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is a legal record of medication orders for each agency. Step number 2. Know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of a medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Step number 3. Perform hand hygiene. This is to prevent the spread of microorganisms. Step number 4. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Step number 5. Transport medications to the patient's bedside carefully and keep the medications inside at all times to prevent accidental or deliberate disarrangement of medications. Step number 6. Identify the patient by checking the name or identification band or ask the patient to state his or her name. This is to ensure that the right patient receives the medication and prevent errors. Step number 7. Explain procedure to the patient to gain cooperation and to allay anxiety. Step number 8. Offer tissue to patient and ask patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to medication administration. Step number 9. Have patient sit up with head tilted well back. If patient is lying down, tilt head back over a pillow. This position allows the solution to flow well back into the nares, and do not tilt the head if patient has a cervical spine injury. Step number 10. Draw sufficient solution into dropper for both nares. Do not return excess solution to a stack bottle to prevent the risk for contamination. Step number 11. Ask the patient to breathe through the mouth and hold tip of nose up and place dropper just above nares. About 1/3 of an inch, instill number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nostril with dropper. Breathing through the mouth helps prevent aspiration of solution. The soft tubing will protect the patient nares from injury during administration of medication. Touching the nares may cause the patient to sneeze and will contaminate the dropper. Step number 12. Have patient remain in position with head tilted back for a few minutes to prevent the escape of medication. Step number 13. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step number 14. Assist the patient in a comfortable position. This ensures patient's comfort. Step number 15. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated from any adverse effects from the medication or procedure.
For the evaluation, patient cooperates with the nasal installation of medication. Desired therapeutic effect is obtained. Experiences no adverse effects including allergy response, systemic effect, or injury. That will be all. Again, this is Mary Rose Garcia, a second-year nursing student from Section Wiedenbach. Thank you and God bless us all.